Hi friends, this is Dr. Abdequaem Chimthanawala. As I always say that there are a lot of remedies, lot of polyglot remedies, which has some uncommon symptoms that we don't read every day. That's why we are unable to prescribe those medicines. Because we have seen only the one side of that polyglot remedy. So today I will take another polyglot remedy with its uncommon symptom which are used clinically in my practice with good results. The remedy which I am talking about is Lycopodium. And I know Lycopodium has been prescribed by you daily in your practice, sometimes in and out, and it's a very important remedy for lots of other complaints. But today I'll be dealing Lycopodium in relation to cough complaints, respiratory tract. Remember, whenever the patient tells you that the cough starts midnight, most of us think remedies like arsenic and that midnight remedies. And arsenic is sometimes abused because of midnight aggravation. If you ask a Lycopodium patient how is the cough, the patient says the cough starts at midnight or aggravation midnight after 4 a.m. or until 3 to 4 a.m. पेशेंट बोलेगा रात को 12 बजे खांसी शुरू होती है और 3-4 बजे तक खांसी रहती है. And then you think about arsenic or kalis and those remedies which have these type of aggravation. But Lycopodium is a very, very important remedy which has this type of aggravation. Cough aggravation midnight until 3 o'clock or 4 o'clock. And you can think about ammonium carb or kali carb or buforana. But Lycopodium is a very, very important remedy in these type of complaints. Then, whenever the patient comes and tells you that, Doctor, when I have just climbed your clinic, my cough increases. That's again an important symptom of Lycopodium, that is cough ascending the stairs. जैसे patient stairs चढ़ता है उसको खांसी शुरू हो जाती है, you must think about Lycopodium. Of course, there are remedies which are more important than these. That's bryonia is there, arsenic is there, iodine is there, zincum metallicum is there. But my dear friends, bryonia, Lycopodium is also a very important remedy when the cough the patient has when he's going upstairs or ascending aggravation. And how is the cough of Lycopodium? Lycopodium has a very, very important barking and loud cough, barking cough and a very loud cough. Because whenever there is a barking and loud cough, we have remedies like Stearinum metallicum or Veratrum or Aconite. But Lycopodium, again, in this relationship has a very, very important that barking and loud cough, especially barking during sleep. If the patient comes and tells you barking cough during sleep, do think about two remedies which I have used mostly in my practice. The first is Lycopodium and the second is Hyposcenium. Now, these two remedies have barking cough during sleep, and whenever these symptoms comes to you, do think about Lycopodium. As you go forward in Lycopodium, one modality is again very important, that bending the head aggravates. Especially whenever the patient bends his head backwards, the cough starts. And this is such a very important symptom in relation to Lycopodium. But normally what we think about in this symptom, that is bryonia or Rumex crispus or Cilicia. But again, Lycopodium is also a very, very important remedy in this type of complaints when the patient says that bending the head backwards, the cough increases. So do think about Lycopodium, because normally otherwise we prescribe these common remedies like bryonia, Cilicia or Rumex, but don't miss Lycopodium. As you go further, Lycopodium has been written that the patient has constant cough day and night. But I have seen and prescribed clinically Lycopodium whenever the patient says that the cough is constant at night. Night coughs and is coughing. Constant cough in the night. Do remember with Lycopodium a very important remedy, that is Conium maculatum, Sepia, Sticta, Medorinum. These are the remedies, but don't forget Lycopodium, because normally what happens, Lycopodium is not thought of in these complaints, but I have got very, very good results when these type of symptoms are present, especially cough constant day and night. Clinically I have seen constant night cough, and that becomes Lycopodium. It is also said that in Lycopodium, the cough is especially in emaciated boys. Dry cough in emaciated boys. You see a patient entering the clinic and he's very dull, emaciated, cachexia, and a lot of cough. So, a cough in emaciated boys, especially in emaciation, do think about Lycopodium. Exhaustive cough. It said that the Lycopodium cough is a very exhaustive cough, especially morning when going to sleep. Now, this again is a very, very important symptom of Lycopodium and the modality now. Lycopodium motility is so important that when the patient comes and tells you that hot application ameliorates the cough, do think about Lycopodium, arsenic, hiparsulf, rumex, phosphorus, silicea. But do think about Lycopodium also if the symptoms of other cough corresponds. As I told you that cough on ascending is Lycopodium, and in Lycopodium when the patient goes down the stairs also there is cough. So these symptoms are so important, that you sometimes miss Lycopodium because we have other remedies which are more and widely used in a practice. As you go further in the chest, Lycopodium has cough which is better by lying on the back. Just I told you hot application amelioration, just in the same way cough is better by lying on the back. And if this symptom, if the patient comes and tells you, don't jump on Lycopodium, there are remedies. You have to have a differential mater medica so that you will be able to differentiate the remedies. Do think about Lycopodium, manganum, aconite napellus. So these are the remedies which has these type of symptoms where the cough is better by lying on the back. So my dear friend, this is something which I wanted to share about Lycopodium cough, and this is just one part of Lycopodium cough. In the next video, I'll share the other part of Lycopodium cough, which is again very important in our day-to-day practice. So my dear friends, if you like this video, do share and subscribe. Thank you.